Now approaching 1 year since the COVID-19 pandemic first started to impact people here in Wisconsin. Early February of 2020 when the first cases were reported. Newswatch 12's Megan Mamlock talked to doctors at UW Health in Madison today. Joins us now live in studio with more on what this past year has been like for them. Megan?
Thanks, Justin. The UV Health medical staff say that they had started preparing before the pandemic really even caught on here in the United States. And they say that they saw what was going on in Italy and other places and knew it was just a matter of time before it became a big problem here.
We did have some concern even early on about, the much more limited idea that someone with COVID-19 at that point might travel to Madison, and we would want a process where we could identify those people, test them, and then get them isolated so that they didn't spread this new disease that we didn't know very much about to the rest of the community.
The staff had protocols in place from when the Ebola outbreak occurred and fell back on that to help them in the beginnings of the pandemic.
We had a lot of those processes kind of in our back pocket. We had a special pathogens unit. We knew what to do as far as PPE to use, and we kind of dusted that off and repurposed it for COVID.
Right now, rates of COVID-19 infection are dropping in Wisconsin, but with the new variant spreading, doctors are pushing hard for people to get vaccinated.
We really want to be part of the solution to ending this pandemic, and the vaccinations are going to be what does it.
UW officials say over the last year, they feel their message has been scrambled by politicians and social media, leaving healthcare professionals frustrated.
Refuting a lot of the falsehoods that were out there, trying to be consistent with our message. And at the same time, we didn't know much about this disease. So what we were learning about it was changing, which I think even gave us as healthcare experts a bit of a credibility problem, because it's not like what we said on day one is what we said throughout the entire pandemic.
Healthcare officials say they've also made a lot of adjustments in how they treat patients during the pandemic, including relying more on virtual visits, setting up drive-through testing sites, and reconfiguring hospital spaces. Dr. Poff also mentioned mask use and social distancing really help limit flu season, and he believes some of those measures may even stick around even after the pandemic is over. He said handshakes might be a thing of the past. We'll be right back.